GLP-1 medications for weight loss have been incredibly successful, arguably the most successful weight loss medications that we've ever had. They're helping people to lose body weight, improve their metabolic health, improve cardiovascular function, and they're ultimately reducing the risk of chronic disease. With any rapid weight loss, there are trade-offs, and we do see loss of lean muscle mass in some people, and we often see weight regain when the medication is stopped. So that's why at Progressive Sports Medicine in our longevity program, education is such a big focus. We don't just support people taking these medications, we help them optimize their body composition while they're on them. We try to help protect their muscle mass. We try to help to reduce the amount of weight that they'll regain when they come off these medications. If we look at evidence, a major study in 2021 followed 1,968 adults with a BMI over 30, and they were prescribed semaglutide. These patients were advised to eat in a 500 calorie deficit based on an estimated resting metabolic rate. They were also told to complete 150 minutes of exercise per week, and they had regular behavioral and lifestyle support roughly every 4 weeks. After 68 weeks, those taking semaglutide up to 2.4 milligrams per week lost about 15% of their total body weight. That was significantly more than the placebo. Then we look at a similar study using tirzepatide over 72 weeks. Depending on the dose, 5, 10 or 15 milligrams, people lost between 16 and 22% of their starting weight. Again, much more than the placebo. When we compare semaglutide and tirzepatide side by side with those people with and without diabetes, we generally saw more weight loss with those people taking tirzepatide. But responses will still vary considerably between individuals. At Progressive Sports Medicine, your physician will discuss whether these medications are appropriate for you, and that will really depend on your goals, your medical history, your overall health, and what the future looks like for you. Importantly, what we do is we look beyond the weight and into body composition, where we'll look at lean muscle mass and see if it's a good idea to combine that with medication. DEXA data suggests that roughly 25 to 40% of the total amount of the weight lost can be coming from lean muscle mass, with the rest coming from fat mass. Participants with a BMI over 40 tended to lose more weight overall. Their absolute lean mass loss was also considerably higher. This is why we take muscle preservation so seriously at Progressive Sports Medicine. Our approach would combine medical oversight, dietetic support, and exercise physiology, as well as the use of a DEXA body composition scan to establish your baseline, your lean muscle mass, your visceral fat, and then repeating those scans frequently to make sure that the program that we're giving you is giving you appropriate outcome. Alongside that, we also prioritize protein intake, progressive strength training, aerobic and high intensity exercise, as well as individualized nutrition plans with our dietitian. The goal really is simple, is to lose as much body fat as we can, but preserving as much muscle as possible. More recently, studies in 2025 have looked at what happens when people stop these medications. Across the Step 1, Step 4 and Step 10 trials, which use semaglutide, we consistently see weight gain after cessation, which is the same for the SURMOUNT studies, which looked at tirzepatide. At Progressive Sports, our goal isn't to pretend that that's not going to happen. Our goal is to try to flatten the curve. It's essentially what we're trying to do is to minimize the weight gain or weight regain that we expect to see through optimizing the right education, the right training, the right nutrition. Our goal is to slow down and reduce how much comes back. We believe that the most successful use of these medications comes from combining them with the gold standard testing like DEXA and a multidisciplinary team approach with sports physicians, dietitians, and exercise physiologists. On this slide, you can see a real client example. They've lost 4.6 kilograms in total, taking tirzepatide. Visceral fat was significantly reduced, skeletal muscle was preserved, and their body weight was reduced. This was achieved through appropriate medication dosing, sufficient protein intake, structured strength training, and a mix of low intensity and higher intensity aerobic exercise.
This content is provided for general educational purposes only. It is not medical advice, does not replace consultation with a patient's own doctor, and should not be used to make individual health decisions. Nothing in this presentation is intended to bypass or replace the role of general practitioners or established screening programs. No patient-doctor relationship is created by viewing this content. If a patient has symptoms or concerns or abnormal results, they should seek prompt assessment from their GP or treating specialist.